Do you consent to be videotaped and have this videotape uploaded to YouTube?
I do.
All right. So my name's Nancy. I'm going to be your provider, and I will be asking you some questions about yourself, okay?
Okay.
All right. So can you start by telling me your age, your name, your age?
Abby Smith,
Mm-hmm.
ABBIE, and I'm 64.
Okay. And what is your race and ethnicity, please?
I'm white.
Okay. All right. And your birthday is?
February 28th, 1955.
Okay, got it. Okay, so this is your annual checkup, but I do want to know if you have any chief complaints at this time.
I've had, not at this time, but up to recently, I've had a very runny nose where like it ran down my face
Mm-hmm.
and my ear hurt at the same time.
Okay, and that was it started 3 weeks ago?
Yes.
Okay. What have you done for those symptoms?
I used aloe vera.
Mhm.
Aloe vera from a plant at my house, drops in my ear and in my nose.
Okay, and how did that help you?
It relieved my symptoms between 24 and 48 hours.
Okay, so the runny nose stopped, like how long did it take for it to stop after you put the velvet in
A couple
there?
hours.
Okay. And then the pain in your ear, what would you rate the pain when it was at the most?
It was like a 9, 10. It was very painful.
Okay, and then after you took the aloe vera, or the
20 minutes.
Took 20 minutes, and then what did you go down to?
Probably a 2 or 3.
Oh, so it's pretty effective for you then.
Yeah, very.
Okay. All right, so, all right, and today, do you have a runny nose today?
No.
Okay, so would you say you're done with this, do you think, or do you?
I'm going to put some drops in my ear, but I think my nose is okay right now.
Okay, well, that's good. All right, and then the drainage that did come out of your nose, what color would you say it was?
It's clear.
It was clear? Okay. And then do you know the signs and symptoms of an infection if you, regarding to the drainage,
Yes.
that it would be?
Yellow, green.
Okay, all right, good. All right, so we know when it started and where it was and how long did it last. We went over that, and then the pain. Was there anything that made it worse, like if you were around pets or dust, did any of these symptoms get worse?
No, I kind of tested in different ways. My husband has allergies, and there's one time it happened when he was having problems, and one time when it happened he didn't have problems. So I haven't been able to capture the source yet.
Okay. All right, we went over the treatments. Okay, when you had that pain, did you use any other pain medications like Advil or anything like that? Okay. All right, well, let's go ahead and go over your past medical history. Have you been diagnosed with any illnesses or long-term diseases?
Nope.
Okay. What about injuries like accidents? Have you been in, to where you've hurt your elbow or your knee or shoulder?
I fell down the stairs and injured my knee, really sprained all the ligaments and tendons in the front of my knee, side of my knee, as well as with my ankle.
And when did this occur?
2011.
2011, okay. And what were you doing when this happened? Were you going downstairs, did you say?
I was walking down the stairs.
Going downstairs, and then you fell, and then that's what happened. And did you go to the emergency room right away, or?
I went to my doctor.
Okay, and then the doctor just gave you what were your treatments for it from the doctor?
Ice, and told me to take Tylenol or ibuprofen. And I was leaving 4 days later to go out of the country.
Did he x-ray it or anything?
Yes.
X-rayed it, and so there wasn't any fractures?
No, he said I sprained them severely. He said it probably would have been better if I would have broke it.
Wow.
Yeah.
Did you have to wear one of those offloading boots or anything like that?
No,
Crutches?
ace bandage.
No crutches or anything, just ace bandage, and you were able to walk. You were allowed to
Limped.
bear weight on it?
Yeah, I limped.
Okay. All right, do you feel like it's fully resolved now, or do you have any residual effects from that?
No, I've been recovering from it since then.
Okay, when was the last time that bothered you, that part of your leg bothered you?
Right now.
Oh, right now, okay. And are you in any pain, or is it just like discomfort? How would you describe how it feels?
It aches. I use CBD cream at night to put it on there, and occasionally I'll use 2 tablets of Tylenol, 220 milligrams each. If it gets worse, the CBD cream doesn't handle it, and occasionally I'll use half a Vicodin if it's very severe.
Okay, I'll make sure to get more information from the medications that you just now was talking to me about. Let's see what else. So you've got your knee, your ankle, and then you told me how you treat it, and it's currently working, but, so there's nothing more. Did you have to go to rehab? Did the doctor recommend you go to rehab?
I did go to rehab, and they just gave me a list of exercises, and I've been doing them at home, and I'm past that now.
Okay, so it's worked for you.
Well, when I first started, I couldn't get up off of the couch by myself, so I've slowly worked up to over 2,000 steps a day, and some days are 3,000 or 4,000. So
That's good.
yeah, I'm
Okay.
definitely recovering.
Anything else, any other medical problems that you needed to be treated for?
Nope.
Okay. Surgeries and hospitalizations.
I had surgery on my gums, 2016, to repair some damage from gingivitis,
Okay.
and it was very successful.
All right. And so currently, like, when was your last dental appointment?
2 months ago.
And what did the doctor say about your gingivitis?
It continues. You never get rid of gingivitis, but he's very happy with how the surgery went and the fact that I didn't lose any teeth.
All right. Well, that's good news. All right. Anything else surgical or any hospitalizations where you spent the night?
No,
Okay. How are your immunizations? Are you up to date on those?
I am. Took a cruise last summer and got up to date on all of them, and I've had my flu shot.
Okay. What month and year did you take your last flu shot? Like this year, like
February.
in February? That was the last time you had it? Okay. All right. Well, next time you come in, if you could bring your records of it so we can add it to your chart here. Okay, let's talk about allergies. Do you have any food allergies?
Yes. Coffee, crab, radishes.
Mm-hmm. Okay, and how do you know you're allergic?
I was tested.
You didn't actually eat these?
No, I don't like them. I never have.
Okay, and then you ended up
2
with
years
like
ago.
you saw an allergist and they did the test?
I saw a homeopathic doctor and he took a blood test,
Mm-hmm.
sent it away to find out what my allergies were with regard to food.
Okay.
And also cranberries and blueberries.
Okay, what about environmental allergies like animal dander or pollen or anything
As far as
like
I
that?
know, I don't have any of those, but the whole thing with the dribble, I don't know if that's an allergy or...
Okay. Yeah, maybe we'll conduct some tests on that.
Okay.
All right, let's see. So what about medication allergies? Are you allergic to any medications, even if it's over the counter?
Yeah, I'm allergic to sulfa, and it's one of the drugs you take for blood pressure.
Lisinopril, maybe?
Yes, that's it.
Okay. Lisinopril. Okay, so what did sulfa, did you actually have a reaction to sulfa?
I did. I had some antibiotics that had sulfa in it, and I ran a very high fever. And
Okay.
the doctor said not to take them anymore, and my husband packed me with ice. Said if my temperature didn't go down to come in, and we recognized it was sulfa. He did test me.
Okay.
That was fun. Not really.
Mhm.
And what was the other one?
Well, getting back to sulfa, when was it confirmed that you were allergic to
Oh,
it?
that was quite a while ago. That was like 1991.
Okay. And then lisinopril, how did you react to lisinopril?
My tongue swole, and so did my throat.
Difficulty swallowing, like you could feel it?
Yeah.
Okay.
I actually thought I was catching something, and I called the doctor, and he said, "Do you have any Benadryl with you?" And I said, "Yes." And he said, "Crush it and put it under your tongue, and then take another tablet." And the symptoms went away in like 15 minutes.
Well, that's good. So we'll make sure we list that as an allergy. And when did you first find out about that allergy?
2016.
Okay. Anything else that you can think of any type of
Nope.
reaction to anything? Okay. All right, let's go ahead and get a little more details about the medications you take. What you kind of mentioned ibuprofen.
As needed.
Okay.
Mhm.
Can you tell me the dosage, like the milligrams?
I'll take 2 tablets of 220 each.
Okay, and you use that for the pain in your knee and
Pain in my knee, and if I have a headache.
a headache. Okay. All right. And then when you said that you did get pain on your leg, how intense is the pain when you do get it?
Well, for me to take ibuprofen is about a 5. If it goes between the 8 or further, then that's when I take the half a tablet of Vicodin. But my prescription of Vicodin is almost a year old for 30 tablets, and I have almost 20 left. I only take a half at a time.
Okay.
It's only in extreme situations
Okay, all right, well, make sure when you get back home to look and see if there's an expiration date on there and see if they're still good that way.
They are.
Okay, and then the dosage, they come in 5 or?
325/10.
Okay, all right, and then you take a half a pill as needed for severe pain. Okay, anything else you're taking for
Vitamins,
vitamins? Okay,
multivitamin,
okay, let me write that down, got it,
B50,
all right,
vitamin calcium,
okay,
400 milligrams and it has D in it. Magnesium, 400 milligrams.
okay,
And potassium, 90 milligrams.
okay. Are you getting checked for your level of potassium?
Yes.
Okay, we'll go ahead and do that too, we'll probably get a full set of labs on you. Okay, anything else that you're taking for pain or discomfort?
Mm-mm.
Alrighty, and then, okay, let's go on to the next thing. Alright, we're gonna talk a little bit about your family history, specifically talking about brothers, sisters, parents, and grandparents, family, like illnesses and diseases.
So I have 3 brothers, and the only thing that 2 of the 3 have obesity, like myself. None of them have any other issues, no high blood pressure or anything like that. We're all pretty active. My mother has had back surgery,
Mm-hmm.
shoulder surgery, and knee replacement on both knees, and on one knee, a secondary knee replacement.
Wow.
My father has had prostate cancer and had his prostate removed,
Mm-hmm.
and has a pacemaker.
Okay, what does he use it for?
He was very active as a young man, and his heart was enlarged, and so his heart rate is very low, and sometimes he would stand up and he would get very lightheaded.
Okay, so it helps when his heart rate goes too low.
Mm-hmm.
Okay. Alright, anything else with your mom and dad?
Nope.
What about grandparents?
My maternal grandparents lived to both be 98. My grandfather had, when he was 90, they diagnosed him with diabetes.
Mm-hmm.
And it was just onset then. He hadn't had a problem before, and he had dementia. And my maternal grandmother she had a heart attack and then recovered from that about 85, 86, and
Mhm.
then had dementia from about 92 till she died at 98.
Wow. Yeah, you got longevity in your family genes. Okay, what about your paternal grandparents?
Paternal, my grandmother died at 58 of heart disease, and my grandfather died at 83 of complications from Parkinson's.
Okay. All right. All right, let's go ahead and talk about various chemicals that we can have, like, do you drink alcohol?
Once a month, maybe?
Okay. When you drink alcohol once a month, how many drinks do you have?
2 max.
2 drinks, okay. Do you use any kind of tobacco products, whether it's smoking or chew or anything at all? No pipes or, okay. All right, and then what about caffeine? Do you consume caffeine?
I'll have like maybe a Diet Coke a day.
Okay, and what size is the
16 ounce.
16 ounce? So possibly one 16-ounce Diet Coke a day.
And then there's another flavonoid from the tea I drink. It's yerba mate.
Mm-hmm.
And the flavonoid is not caffeine, it's called matine.
Mm-hmm.
So it doesn't give you the jitters. It doesn't operate the same way that caffeine does.
Okay, I'll write that down. What about illicit drugs?
Nope.
Okay. All right. Diet and exercise. What kind of diet are you on now? Like,
I do intermittent fasting,
okay.
primarily high protein, low carb, although I don't really worry about what I eat because if you're fasting for 16 to 18 hours, it takes care of how much you wind up eating and how many calories you ingest.
Okay, when did you start this plan?
A year ago, April,
Okay, April. Okay.
and I lost 109 pounds.
Wow, that's awesome. That's good. You feeling better?
Lots.
Did it affect how much your knee hurts, or if it hurt? If it
I
hurts
don't know
less?
because it was in the process of working on it, but I would imagine it would help. I mean,
Yeah.
if there's less weight on it.
Right. How many meals do you have a day?
2.
2 meals. Okay, and then
And a snack.
can you describe, not necessarily particularly what you eat, but Like, is it carbs? You said it was low carbs, high protein.
Any kind of protein, green vegetables, broccoli, cauliflower, spinach,
And the meat that you eat is
all meats.
all kinds of meats, okay?
I might have a bacon, spinach, tomato sandwich on really high fiber bread
Okay,
with mayonnaise.
right, sounds good. And then, let's talk about exercise. Are
About twice a week.
twice a week?
Mainly it's keeping my steps up. So every day I work on a minimum of 2,000 and then going beyond that.
Okay, 2,000 steps a day
And
is your
then
main goal.
Yeah. And then I have a life cycle and a Nordic track at home.
Mhm.
I can't do the Nordic track as much, but the life cycle I can do.
Okay. All right, how much water do you drink a day?
A lot.
Do you have it measured out to where you can give me an idea?
No.
So like, let's say a Coke, the Diet Coke that you drink, you say it's 16 ounces? So if you could have to guess,
6 to 8 of those,
wow,
and then additional tea.
okay,
I literally have something in my hand all the time.
okay. So it sounds like you're drinking enough water. I'll figure it out.
Well, I go
Recommend
pee
it.
every 2.5 hours. Trust me, I have.
Okay, all right. What about, have you ever been pregnant? Do you have
Nope.
any children?
Yep.
Okay,
I have 2 kids from my husband's previous marriage.
okay, but have you ever been pregnant?
Nope.
Okay, all right. And so what's your sexual history then? You're,
Very good. No.
you know, like, in other words, are you?
I've been monogamous for
Okay.
32 years.
All right, okay. All right, we're getting there. All right, so
Can you give me just a minute? Can you
Okay.
pause?
I don't know if that's considered, let me try.